Okay, so today we're going to perform a DTM, dermatophyte ringworm culture, and I'm going to go ahead and show you how we do this. So I'll show you what we have here for our supplies. So we have our test medium, so this is our culture. We have some dry gauze, we have some alcohol to prep the area. I have my cold tray, and I'm actually going to use the hemostat to remove our hair sample, and then I have a Sharpie. We're going to use to label our culture with our patient's name and date. So we'll go ahead and we'll get started. And I'll go ahead and just kind of zoom in over here so you can see. Okay. Good girl. I'm so sorry. Okay. So the first thing we're going to do is we're going to go ahead and we're going to prep the area. Now, Aria doesn't actually have any lesions, but we're going to assume that she has a lesion just right here. So this is the area that we're going to prep. You always want to make sure you're wearing gloves, absolutely, with ringworm. Okay, so we have our isopropyl alcohol. We're going to go ahead and prep the area. Okay. The next thing we're going to do is we're going to take our, so I'm going to use a curved hemostat. I'm getting it from my cold tray. You want to try to do this fairly aseptically. You don't want to grow anything on the culture that would cause a kind of a weird or negative result. So I'm going to go ahead and take my hemostat. And I'm going to grab, you want to make sure the hair is at least 0.3 centimeters long. So I'm going to go and I'm just going to grab a fair amount. So first off, I'm going to make sure that our culture is ready and open. So you want to take your hair sample. So you would be doing this, we're going to get quite a bit more hair here, but we're going to do this, we're going to get a fair amount. Also, if the dog or the cat had crusted scaling, you want to get a little bit of that in there too. Good girl. I got a good tuft there. You want to try not to touch the medium. You want to try to just kind of dump it in there. Go ahead and take a little bit more. And you want to pull in small tufts. You don't want to pull a large amount at a time. You do this because it can be a little uncomfortable. Whoops, I dropped that piece, so we're not going to use it. You want to do it in small tufts because you want to make sure that it's not it's going to be a little unpleasant for the animal anyways. So you just want to make sure you take it in just small tufts. Good girl. You're so good. Okay. Okay, so we're going to call that good. Okay. Okay, so we'll set that aside. So the next thing we're going to do, I'm going to show you. We're going to go ahead, we're going to put our lid on, and we're going to close it, but we're not going to close it very tightly. We're going to leave the lid a little loose. You do that so it can aerosolize. If you were to just completely close it, it wouldn't be able to get air. So that's according to the manufacturer's instructions. So the next thing we're going to do is we're going to write our patient's name and date. Okay, so let's see if I can focus a little bit better here. Okay, so this is kind of what our culture should look like. So you want to make sure that you get your hair onto the medium you want to make sure it's actually touching here. So this is kind of what it would look like. Again, you want to get some crusts in there too if your animal's lesion had some crusts. But mostly the hair. So let's see. The next thing we're going to do is we're going to go ahead and pause the video and we're going to wait for this sample. So according to the manufacturer's instructions for our DTM cultures, this is just kind of a standard MWI DTM culture. You want to check it daily for 30 full days. Every single day you check it, you want to record results. Usually you record it as no media or color change, or you could write, you know, color change, growth noted. So when we double check this, when the time comes, we'll read the results and I'll go over, if this is not a positive result, then I will go over and show photos of what a positive result should look like. So, okay, so we'll go ahead and stop now. Okay, so today we're going to go over our DTM culture results and we're going to discuss different things regarding ringworm. So we'll go ahead and start off with going over our results. So it's been a full 30 days. So every single day we've recorded all of our results. Every single day the technicians come in, and one of our responsibilities to do in the morning is to look at all our DTM cultures and record to the patient's corresponding chart. So I will show you our culture that we've grown. So we have followed manufacturer's instructions. We've kept it in a basically a dark place, or rather a not super lighted place, a fairly nice and dark place. The media or the DTM culture has been stored at room temperature per the manufacturer's instructions. It hasn't gone below 36 degrees Fahrenheit. Hasn't gone above 77 degrees Fahrenheit. So we've kept it in the correct environment in which we are instructed to per the manufacturer's instructions. So I'll go ahead and I'll show you my culture here. Okay, so here we go. So here's our culture. As you can see, it looks pretty darn unchanged. So you can still see the hair is just in the same spot. We don't see any signs of mold, any signs of growth, and the media color is exactly the same. So it has been a full 30 days, and it's safe to say now, per the manufacturer's instructions, that we deem this a negative result. So for these tests, you need at least 3 weeks of no change or color growth to confirm it a negative. Oftentimes, if positive results come up, you'll see it in the first 14 days. However, that's not always the case. So you can see positives as far as 4 weeks out. So that's why we keep it a full 30 days. We check it every single day for media change and color growth, and we mark it in the patient's chart. So I'll also show you kind of what we do as far as marking our patient's chart here. So hopefully you can kind of see this. What I think I'll do is I'll take the camera and I'll show you what we do. So this is just kind of an example of what you could do to record daily in your patient's chart. So we have our patient's information here. We have the corresponding doctor, technician on the case, or veterinary assistant. And basically for every single day, for an entire 30 days, we would have the technician look at it and they would write down what they see. So no growth or media change, and then the technician's initials. And we see that for pretty much every single day for the entire month. So that tells us that it's been looked at every day, there's been no changes day to day, and that we can now bring these results to a doctor and they can confirm that this is indeed a negative result. Only they can, address that. So, or diagnose it rather. Okay, so a few other things. So this is just kind of an interesting photo. So right here on your left, you see a negative result. So actually this is a result that doesn't even look like it has a sample in it. So this is basically a sample without any, or a culture without any sample in it, excuse me. This one on the right here, this is an example of a positive DTM culture. So you see the red media change, you see the fuzzy growth on it. This is what we would deem a positive. It does have different looks to it as well. There can be, here's another photo of a positive DTM culture. It doesn't always have to cover the entire media, but you will almost always see at least some media color change and or growth, oftentimes both. Okay, so now that we've gone over our patient's results, the next thing we'll do is we'll go over a few other things. Okay, so what is ringworm exactly? So ringworm is a fungal infection. It is a zoonotic disease. So basically it presents as lesions. Most of the time it presents as lesions. Usually they're alopecia lesions, they're hairless lesions. Oftentimes they're round, not always, but very often. And they can be a pretty big deal. So they affect dogs and cats. Very frequently, it's a commonly seen thing in kittens. And I'll just kind of show you some photos of what a typical ringworm lesion looks like. Okay, so hopefully you can see this. So this top photo, this is a pretty severe example, probably not the best one to start off with, but a pretty severe example of ringworm lesions. You see this red, hairless, alopecic region. This is kind of a more commonly seen example. So you can see this hairless lesion right here. So that's oftentimes what we will see in veterinary medicine. When you see just a localized lesion, you'll see something very similar to that. You'll see kind of a mild pink hairless redness or hairless region. This is kind of if it's, I wouldn't classify this myself as like severe. This is kind of typical presentation. Okay, I'm gonna move on. So, as I was saying, it's very common occurrence in kittens. This is a kind of an example. Cats sometimes can present a little differently. Oftentimes they'll just show with hair loss. So you'll kind of see this alopecia on the pinnas. This is very common in cats, kittens especially. This is actually a picture of a kitten. So you notice the hair loss on the back of the pinnas. This is a cytology of dermatophyte. So we'll go ahead and talk about a few more things. So as I was saying before, this is a zoonotic disease. So this is a lesion that you would see on a human being. So this is actually a photo of a human being. It tends to have, not always, but it tends to have a kind of a typical presentation. They call it kind of the bullseye presentation. You can kind of see why they call it that. It's usually a circular lesion with kind of a red circle lesion in the middle. So it does actually look kind of like a bullseye. Doesn't always look like this, but they often look very similar to this. Okay, so now that we've gone over that, we'll go over treatment and what else we do for this kind of thing. So treatment generally consists of antifungals. You can try topical if it's like a localized, it seems like veterinarians sometimes will reach for a topical antifungal lotion, Conazole lotion, ketoconazole, topical lotion. But oftentimes you'll find them reaching for oral antifungals. The reason is because the main concern with ringworm is that it's zoonotic. So if your patient has ringworm, it can spread and it sheds it into its environment. So oftentimes ringworm can be self-limiting. Patients can get it and it may just resolve on its own, but the biggest concern that we often have is the fact that it's going to shed into the environment. So a lot of times people just don't want to have to deal with that. They want to go with treatment to get rid of it. So ketoconazole is a big one. Miconazole is one that you can also use. Oftentimes that's like a topical type treatment. But bottom line is usually it's systemic antifungals, sometimes topical antifungals as well. I think that's kind of all I have. So see if I have any more photos. That's kind of what I have. So the very last thing we want to do is we want to make sure that we record this into our patient's chart. So we're going to say DTM, culture, negative, assuming the veterinarian's in agreement. And you put your initials and you make sure that that's in your patient's chart. Okay,